Hi students, welcome to next session in oral pathology. I'm Dr. Gopi Krishnan discussing oral pathology with you. Okay, so in this video, we are going to discuss about one another important cyst, that is your calcifying odontogenic cyst. Okay, calcifying odontogenic cyst. So from the name itself, we will get a clue that there is something calcifying in it. Okay, so calcifying means it is getting a deposition of calcium. So this is an odontogenic cyst with some kind of calcification. The other name of the cyst is a Gorlin cyst. Gorlin cyst. Okay, this is another name. So what about a calcifying odontogenic cyst? What is the feature of calcifying odontogenic cyst? What question they can ask you from this? Okay, so calcifying odontogenic cyst or Gorlin cyst, it is actually a cyst, odontogenic cyst, that usually comes in the anterior part of your maxilla. Okay, the most common site for this calcifying odontogenic cyst is anterior maxilla. See, this is very important. So far, we have seen posterior mandible as a common site for your dentigerous cyst and your OKCs, right? So, COC, the peculiarity of COC is 65% of the cases, okay, 65% of the cases, they come in the anterior maxilla, your incisor canine region of your anterior maxilla. Is the most common side of this Gorlin cyst, and it can come along in association with your impacted canine. So most of the cases there will be a impacted canine associated with this COC. It can also come. So please remember this statement. I am writing a very important statement now. A COC can come along with an odontome. Odontome, it can come along with an odontome. There will be COC. Okay, COC can come along with an odontome. That is one important point. That was a statement in one of the INI CD paper. Okay, so the person who have an odontome in the anterior maxillary region, he is having a cyst that is most probably a calcifying odontogenic cyst. Okay, so this is a little feature about this COC and the importance of COC. Okay, what question they will ask you? Can you see the radiograph? I will show you the radiograph here. Okay, what about the radiograph of COC? Can you see the radiograph here? Okay, we are seeing a radiolucent lesion there. We are seeing a radiolucent lesion. It usually comes in the anterior maxillary region, but it can come in posterior also. 65% of the cases comes in the anterior maxillary. So, what about the radiograph of calcifying odontogenic cyst is that the cyst will appear in a unilocular radiolucency. It is a unilocular radiolucency. A well smooth margin is there, and in that you can see some kind of calcification, some kind of radio opacities. So it is very interesting. The radiograph of your COC is that you are seeing a unilocular radiolucent lesion. That is a very good unilocular radiolucency, but in that within that you can see radio opacities or irregular radio opacities are also seen along with this. That's why we say it is a radio opaque lesion along with the radiolucent lesion. Now, from where these radio opacities are coming? That calcifications. Calcifications will appear radio opaque in a radiograph. Right, calcifications appear radio opaque. So, calcifying odontogenic cyst, from the name indicates, we can say that is a radiolucent lesion with a radio opacities. Now, this radio opacities inside the radiolucent lesion, can you see in this picture, in this radiograph? Okay, we have a certain radio opacity seen here, and that is appearing as a cloud like appearance. Okay, a cloud like appearance. So there is interesting terms in this radio opacities. We can say that fluffy cloud appearance, or we say salt and pepper appearance, or crescent moon appearance. Crescent moon, salt and pepper, fluffy cloud. These are all the fancy names given to that radio opacities which is seen inside the radiolucent lesion of COC. Okay, so that is the picture you should imagine. Okay, so this is a cyst. Peculiarity of the cyst is, so far we were seeing radiolucencies, only radiolucencies, right? In dentigerous cyst, it was radiolucency with a well corticated, very smooth margins. In OKC, it was a radiolucency with the scalloped margins. In COC, we have a radiolucency with a good smooth margin, but it has some kind of radio opacities inside this that will look like a cloud, fluffy cloud, salt and pepper, or crescent moon appearance. Okay, so this is one thing. Now the next thing is about the histology. What you see in the histology,